I'm Dr. Abhijit Desai. I have been into the field of ophthalmology since the last 24 years, and I'm here to talk about all about LASIK. Uh, LASIK is basically a laser-assisted in situ keratomelusis. That's the full form. But in short, what it means is we can correct the powers that you have in the form of spectacles and change that curvature of the eye and give you the correction. So it's basically a very high level computerized algorithm which helps the laser in correcting the um, number. Now, which people can go for LASIK? So this is the most common thing that is asked to me, and basically LASIK is advised only after the age of 18 if the numbers are stable for at least 1 year. Now, this from the age of 19-20, we tend to give an advice of LASIK up to around 45 max. Because after that, there is a reading power which can actually not give you the complete spectacle independence. Again, as we are talking, if it's a very high number, even then, depending upon how much is the requirement for the person, we may decide to advise a LASIK or not after that age, or depending upon whether the cataract is there, we can offer different options at that age. So let's talk about LASIK itself. So how do we decide who is the right candidate? So when the patient walks in, generally the most common thing which is treated is something called myopia and astigmatism. What is myopia? Myopia means that the person's eyeball is a bit longer, and because it's longer, the rays of light which are coming from far away tend to fall just short of the retina. Now, because of this, what happens is you need to give a concave lens as a correction in the spectacle power, or you wear a contact lens. And if you don't want to wear these two things, then we think about LASIK. The other thing which can be treated with LASIK is something called hypermetropia or a plus power. So myopia has a minus number, whereas a hypermetropia has a plus power. Now, unfortunately, in the plus powers, small plus powers are easily corrected by the LASIK, but higher plus powers cannot be corrected because they have a tendency to recur back again. So, generally, we don't advise LASIK if the patient is a high hypermetrop or a high plus powered uh, as a error. So when the patient walks in, what we start telling the patient is first we check whether your numbers are stable. So from the existing prescription, we check whether today's prescription has not changed much. That means if it's that way for at least a year, in that case, that person is eligible to go ahead for the workup for LASIK. Now, what does the workup for LASIK include? It includes first checking the number without any drops being put. Then we check the number after dilating the muscles of the eye and relaxing the muscles and having the actual power at that time. And we recheck the number again without the eye drops again. So this is a three-fold check which we do so that we are sure that this is the error that we are going to correct, because that's what is going to be entered into the computer, and the computer will then give the signals to the laser and that will give the correction. Uh, After this, what we check is the surface of the eye and the thickness of the cornea. Cornea is the structure which we are going to reshape, so it has to be adequately thick. If there is a problem with that thickness, in that case, many a times we refuse LASIK as well, or we give an alternative procedure called a surface treatment or a PRK. Now, these kind of decisions are taken only after the workup is done. The other important part of the workup is the surface of the eye has to be regular. So we check, do something called a corneal tomography, and we check whether the front surface as well as the back surface of the cornea is regular and there are no flags on them, because there are certain cases like keratoconus in which you tend to have a conical cornea rather than a spherical cornea, which are absolutely contraindicated for LASIK. Now, once we do that, we also uh, we also have something called pupillometry, in which we check for the size of the pupil in daylight and the size of the pupil in uh, dark, and accordingly then we decide what is the zone of the treatment which is going to be given to the patient. After that, we also do something called a dry eye workup. The dry eye workup is basically to find out whether there are any tear film deficiencies. And so, where I left was, whenever these things are done, once the entire workup is done, we talk about what are the options available. So, the first option is something called a PRK, or refractive keratectomy, in which the entire laser is given on directly on the surface of the cornea, because of which there is a big raw area, and that raw area takes around 2 to 3 days to heal. But this healing is not very smooth. So once that healing is complete, it takes uh, 2 to 3 weeks, more than 2 to 3 weeks, for this surface to become very smooth, and that improves the quality of vision at the end of 2 to 3 weeks. When we are talking of LASIK, LASIK is basically a flap which is raised from the surface. So if this is the surface, we raise a flap, give the laser in the base, and keep the flap back again. Once this is done, the entire cut which is there is just a line, and that line heals off in 24 hours. So the recovery of the patient is immediate, and uh, recovery of the patient is immediate, and they start seeing right from day one itself. So it takes around 6 to 7 hours for that line to heal off, and the patient is comfortable after 6 to 7 hours. And the next day onwards, the visual rehabilitation is more or less around 98%. The rest of the 2% healing happens over the next anywhere between 2 weeks to up to 2 months. That's an individual healing process. So we really can't uh, give any guidelines as to which person will take that long to heal and which person may not get that long to heal. The other options that we looked at were bladeless LASIK, which is a femto laser assisted LASIK. Now, when we are cutting the flap, you can use a microkeratome, which is a blade, which is an automated machine, obviously, but then it does not give you the exact depth all throughout. So, for more accuracy, a femtosecond laser was invented, which helps in cutting this flap, and you lift it up and you give the treatment. The procedure remains the same, and put the flap back again. Again, the healing is in a day's time, but the accuracy of the entire procedure increases because both the steps are being done by two different lasers, though, but by lasers. Another new thing which has come up is something called Smile. Now, Smile is again something which is a small incision lenticule extraction surgery, in which you remove a lenticule. The laser, femtosecond laser, is used, and it's a different type of laser. You can't use the same femtosecond laser for the flap here, but this is used for removing the lenticule, and you can remove it, and it heals off within 2 to 3 hours. So the recovery is faster. The visual recovery is in another day's time, but the cut on the eye, as in the line, is hardly around, let's say, 6 to 7 millimeters. Now, what do we do if the patient is not eligible for a LASIK? Now, if the patient is not eligible for LASIK, that means one, the number is not stable. Two, the patient is underage, so less than 18. That would be the thing. Three, if the patient has a keratoconus or a chance of getting a keratoconus in future. In that case, we don't ask them to undergo LASIK. And four, we try to avoid any pregnancies or uh, any hormonal changes for at least 6 to 9 months after the procedure. So these things are to be very clearly spoken to about to the patients, and these are to be completely avoided. Now, in case we are not able to do a LASIK, In that case, we have a procedure called ICL, which is an intraocular columnar lens, which is a very soft lens, which goes and sits on your normal lens. So many patients who have very high numbers are not eligible for LASIK because you can't remove that much tissue from the cornea because you will leave it very weak. Now, to do this, what we do is we take the measurements of the eye and send them to the manufacturer, and the manufacturer actually makes a customized lens for that particular eye. And then when we get the lens, we ask the patient to come down and get operated. So we do one eye on, let's say, day one, and the other eye on day three once we see that this eye is settled down. So both the lenses are ordered together, and then that's how we would do a sequential surgery. So the post-op care, whatever we are doing after this particular thing, is mainly it is going to be about in the new age era about the screen time. That's what most of the people do ask me. But the recovery is immediate, so you can do your day-to-day activities right from day one onwards. I generally advise patients to go back to their screen time gradually. So if you're, let's say, 10 hours on screen, it's not a good idea to start that right from day one. So maybe you can do half an hour, 1 hour on day one, then increase it slowly. But if you're going to go back to 10 hours, then the problem of dryness of eyes would be there and it would take time to heal that much. So in that case, what we usually advise is to use frequent lubricating agents. The other eye drops, which are mainly antibiotic or any other anti-inflammatories that we give, generally are stopped at the end of 7 to 8 days. Generally, the patients are told not to have a head bath or not to allow water going into the eye for at least a month, and the head bath is not allowed for 3 to 4 days. Eye makeup in cases of females is generally allowed after the first 15 days, but preferably they should use it outside on the lid, not on the inner part of the eye. So that helps in cleaning, making it easier to clean. After 1 month, it's like any other normal person, and you can just go back to your normal work. I think that's all I can talk about LASIK right now. And if you have any questions, you can let me know. Uh, I have a question here saying, what is the recovery time after surgery to return to daily activities? As I said, daily activities like routine daily activities is right from day one onwards. But if you're talking of gymming, if you're talking of computer screens and everything, maybe after 3 to 4 days, you can go back to the same. Uh, Somebody is asking me, I want to know is pros and cons. Pros and cons for what? For the LASIK? Uh, if a person is dependent, what I mean by that is very high numbers, they literally can't find their spectacles if they lose it. For them, that's the most beneficial. These are the patients who are going to be the most beneficial. Apart from that, the rest of the patients, you will need to talk about how much of dependence are you on the glasses or on the spectacle powers, and then accordingly take a call about, yes, whether you want to go ahead. Now there are patients who come to me from who want to join Air Force or who want to join the army, and there it's a actual requirement that they don't need glasses. They shouldn't be having glasses. So those are the patients. Even with small numbers, we do operate, and the accuracy with the present technology is so good that it's going to give you great results. In fact, we have something called Contura on the Wavelight platform, which actually corrects even the minor bumps which are there on the surface, and that actually gives you a better vision than even a normal person. Uh, there's another question that post care, how long is it effective? Uh, Post care is, as I said, for a month, and the lubricating drops, I prefer that you would use it for at least 3 to 4 months. And if you're with computer screens, it's not a bad idea to use it regularly, even for normal people who have not undergone LASIK. The LASIK is effective as long as you're alive. We have cases of something called regression, as in some number comes back. It's not never an entire number which would come back. It would be a very small number, a percentage of whatever we are correcting. So let's say if it's a 10 power that I'm correcting, you'd get a 5% regression over a period of 10 years, maybe. So it would be a zero point 0.5, which is a very, again, a negligible number. Uh, as I said, we can do this procedure after the age of 19-20 is the ideal time, because at that age, generally this body stops growing and so does the eye. So the numbers remain stable. There are extremely rare cases in which these numbers do continue to increase after the age of 19-20. So in that case, we have to wait till it actually stabilizes and then we treat. Somebody's asked me, can I do LASIK after cataract surgery? After cataract surgery, the indication for doing LASIK is basically if you have a refractive surprise. Now, with all the technology that we are using, we try to be as accurate as possible after the cataract surgery to give you a zero power. But in spite of that, machines will be machines and there are errors, and sometimes you can end up having a refractive surprise. If there is a refractive surprise, in that case, a LASIK is indicated in a cataract surgery if the patient is eligible for it. Again, the patient undergoes all the eligibility criteria, and only then do we advise that person a LASIK. The eligibility, somebody is asking eligibility tests for LASIK. Yes, the eligibility test, as I said, is something called corneal tomography. We do something called pupillometry, and we do something called a dry eye workup. So those are the eligibility tests and the corneal thickness. Uh, Another question here is LASIK a permanent or a temporary treatment? It's a permanent treatment for the distance vision. So any person who does not have glasses needs to wear glasses after the age of 40 for reading. That's what we call presbyopia. So that is something which will remain in spite of doing a LASIK. So even we are making the person a normal person for the age till the age of 40, let's say, and after 40 they are going to be like any other person and require reading glasses. So age limit, as I said, for the LASIK is basically a minimum of 18 to 19 years, and a maximum of 45 is what we do at our place. There are people who come after age of 45, but then if they do have even a smallest amount of cataract, the cataract surgery is a better option in today's time, because we are able to give you complete freedom from glasses after cataract surgery, in the way of putting trifocals or EDOF lenses in which they correct for the distance as well as for reading. So at that age, rather than doing a LASIK and then again going in for a cataract surgery with a single surgery, you can get rid of both the problems. Hmm. I think I've already covered the question. How long does LASIK apply? It's a permanent treatment. And do I have to wear specs again in future post LASIK? After 40, you need reading glasses and very minor regression, but that doesn't happen in everybody. It's like, again, a 1% chance of regression. There is an age limit for LASIK, as I explained, is the eye is growing if you are taking it in the younger age. So even if I do correct a particular number, you will get back, the number will still be growing. So it has to be stable. So that stability is at 19, and again the power still varies even after the LASIK. No, it does not. So it remains the same after LASIK. Again, as I explained, after 45, you have better options to go for rather than LASIK. Will there be a cost difference based on the city tires like Tire 1 and Tire 2? Yes, there would be, but it would again depend upon whether the person has a the latest machine, the newest machine. Again, the femto laser, again, an investment would be a higher machine. There are certain disposables which are one time use, and those are pretty costly. Where were we? So those are the, that's why the cost is different. Glaucoma patient, can I go for SLT eye procedures to control my IOP levels? Again, depends on what kind of glaucoma you have. I don't think this. I didn't get the question here. This is called, what kind of LASIK is required on non-progressive lens? Mm, LASIK can cure myopia. That it can correct myopia. Let's not say cure it. Uh, it can correct myopia or nearsight or even hypermetropia or long-sightedness, but in limited numbers. So there are uh, cutoff points which we follow, and beyond that we don't advise LASIK because it's not good for the eye. There will be other problems in the eye. LASIK in sugar, thyroid, and cholesterol patients should not be a problem as long as they are well controlled during the surgery time. The only problem with sugar patients is infection, so that's something that you would get. Would eye power increase post LASIK surgery? As I said, it's a percentage of the power that we are correcting that would regress over a period of 10 to 12 years. So let's say if it's a minus 10 that I'm correcting, in that case, a point 0.5 would come back after 10 to 15 years. But if you're talking of a very small number like 2, it's a very negligible number. So it hardly, so that those kind of patients do not have any numbers which come back. My eye numbers are -7. LASIK is good for me, and how will it be suitable for me? Is there any problem in future? So -7 is something which is a considerably high number. So I would suggest you to have a complete workup to see whether you are eligible for that particular surgery and whether it is safe for you to get a surgery done. So if it is not safe, then we will see the eligibility for ICL and then advise you on ICL. So, what we have learned in this session is basically we have four different types of corrective measures for myopia or nearsightedness or hypermetropia or long-sightedness. And we do not have any correcting measures for presbyopia, which is after 40. So we can do a surface treatment called PRK, or we can say we can do a LASIK, which is with a blade, or a femtosecond LASIK, which is a bladeless surgery. And the fourth thing is a smile. In case we are not eligible for this, we end up with ICL. So the best thing to have knowledge about whether you can actually go in for such a procedure or not is to actually visit your doctor and go for all the test eligibility criteria and uh, accordingly decide about getting operated. Thank you.